For most people, it's a simple act of breathing, one we perform some 20,000 times every day. But if you are one of the more than 350,000 people in Oregon with lung disease, breathing may not be so simple. Indeed, you may be fighting for every breath you take. Though you may not read about it or hear about it, breathing problems are on the rise. Lung disease is the #3 killer in America, and the death rate is climbing every day. No one knows when this disturbing trend will end, but research is underway to stop this killer in its tracks, and the American Lung Association of Oregon is leading the way. The American Lung Association of Oregon supports research aimed at discovery to find cures and better treatments for lung disease.
Research is very important into the prevention and cure of lung disease, but it has to be looked at in terms of the time it takes to develop the information. The American Lung Association of Oregon provides the seed grants that allow the young investigators to provide the discoveries that then lead to larger grants and to a big payoff. And research is not something that can be achieved instantly. But if you can prevent problems before they start, you're way ahead of the game. And frankly, that's one of the important areas of research sponsored by the Lung Association that's been very important in Oregon.
In its early days, the Lung Association provided information to control the spread of tuberculosis. Lung Association programs helping people stop smoking grew out of research that proved that smoking causes lung cancer, emphysema, and chronic bronchitis. The clues to these discoveries were found in basic scientific research, the type of research crucial to achieving breakthroughs in our understanding of lung disease.
We can prevent disease and we can cure disease in ways undreamed of 10 to 20 years ago, and all this is a result of research.
Or therapies that lead to major breakthroughs in the treatment of lung disease, such as lung volume reduction surgery for those suffering from emphysema.
Lung reduction surgery with emphysema and with lung disease, you don't have a lot of options. It's a regressive disease. You're going to go down and down and down, and there's nothing out there for us.
Lung volume reduction surgery is based on the principle that the underlying reason for the shortness of breath that many people have with emphysema is that their lungs have lost that stocking-like elasticity, and that by making those lungs smaller so that they fit within the constrictions of the chest cavity better, those properties of elasticity will return and allow the exchange of air to take place better.
For some of us, that's our only chance. I remember the first day in ICU. I woke up in the morning, realized where I was, and I took a deep breath and realized that I could breathe. There's no way you can explain that all when you've gone through 5 or 6 years of not being able to breathe. Just to wake up in the morning and go, and it's just, you just wake up. And it's been that way every day since.
It's like your lungs are getting crushed, you know? And it's hard to breathe, like you got a rag stuck in your throat, barely breathing. And I always have an inhaler by my nightstand.
In Oregon, it is estimated that more than 150,000 people suffer from asthma. 55,000 of them are children. If you or someone you love has lung disease like asthma, the Lung Association has a number of programs that can help you. Through the work of its many volunteers and with the support from both the private and public sectors, the American Lung Association programs teach those with lung disease to live healthier, more normal lives. Programs that teach children to understand and control their asthma, such as Camp Christmas Seal.
Part of the magic of camp is that since it is centered towards kids with asthma, and we're the only camp in Oregon for kids with asthma, they want to come here. This is special to them, it's for them, and they look forward to it every single year. I have parents that say, my kid canceled everything this summer just to come to your camp.
Well-controlled asthma won't limit your activities. You just have to keep on top of it. And coming to a camp that's geared for asthma allows kids who otherwise have their parents monitoring their asthma regularly at home. It gives those kids a chance to come somewhere else and learn more about asthma, be around other kids who have asthma.
Most of them are returning because kids, once they come here, they're pretty much hooked. They keep coming back year after year.
The Lung Association also sponsors programs that help keep kids with asthma healthier and in schools.
Woodlawn became involved in the Open Airways program last year. The staff was in-serviced on the Open Airways program and became involved in the asthma management program in the spring, and they were given materials to reference to in case students experienced an asthma episode in the classroom.
The big deal about tobacco is that it kills more people than anything else.
The Lung Association is also leading the fight to guard children against tobacco addiction. Through educational materials and other programs, your American Lung Association is teaching kids how to avoid the deadly tobacco trap.
In 7th grade, I got involved in a letter writing campaign, and I feel it's very important, and I really like to stay in it because smoking, it kills you. And I would really like to be a part of this in the future because I personally think I can lead kids to stop smoking and to not start smoking.
This is it. Last puff.
Your American Lung Association works in the community as well as in the school, helping those with chronic lung disease and their caregivers to better manage their disease. The Lung Association also offers more than 200 publications developed to help everyone enjoy healthier lives, from smokers struggling with tobacco addiction to homeowners seeking to protect their homes from indoor air pollution. The American Lung Association champions the cause for cleaner air and healthier lungs for all Oregonians.
As a physician, what disturbs me is that I know that air pollution is here. I know that there are many agents that are affecting our lungs and our children's lungs, but it's not obvious to people who can't see it, feel it, smell it. And so it's very important for me to get the message across that we need to protect ourselves and our children from the air pollution. Children in particular are out there exercising every day, running around, inhaling deeply, and as their lungs are growing, what they inhale affects how their lungs grow.
New research shows that current standards for many pollutants are too lax. The Lung Association is leading the charge for stricter standards of ozone, sulfur dioxide, and other dangerous air pollutants, and our voice is being heard from Salem to Washington, D.C. American Lung Association action promotes healthy solutions, money-saving solutions that prevent lung disease and help reduce the cost of treating it. Whether it's through research, education, or advocacy, your American Lung Association of Oregon is hard at work helping those with lung disease and promoting lung health. But none of our work would be possible without your support. You are essential in creating a world free of lung disease, and you can help in so many ways. Volunteer your time to increase awareness and encourage action in your community. Give generously to our annual Christmas sale campaign, or designate the American Lung Association of Oregon in your annual workplace giving campaign and your future gift planning. Or join hundreds of Oregon businesses and your neighbors in our annual fundraising events.
Oregonians love to get out and cycle, so this is just a perfect opportunity to have Albertsons and the American Lung Association tie together and do something for the community.
Help stop the spread of lung disease. Call the American Lung Association of Oregon today.
There's some things that I thought I couldn't do, but not anymore.